Am I recording? Testing, testing. Hello, testing. Okay, now it's recording. Okay, got it. I already said both PowerPoints that are up on Moodle are the same by mistake, so we're just gonna go through the cranial bones now. Facial bones will come up later. Okay, so talking about cranial bones, you remember your anatomy from last year. You went through all of these bones of the skull, correct? Yes. So what does this one look like? Have you ever seen something like this? So this is actually a CT reconstruction, a 3D reconstruction of the head. They were doing someone's CT head, and they actually, the guy had or the patient had a gunshot wound in the head. So once they did all the axial CT, plain CT, images, they actually did a reconstruction and constructed it like this so that the radiologist can see where is it that's fractured. Mandible is fractured, the bullet went through the base of the skull and fractured a bunch of stuff. So things like that you'll be able to see in CT, thing about CT. So let's talk about your skull, right? Let's see. Last year, this movie was very popular, so that's why I put it there. I like this movie. Anyways, so how many cranial bones do you guys have? Everybody has. 8, right? 8. You've got the frontal bone, right? You have the frontal bone. You have your ethmoid. You have sphenoid bone. If you go to if you look at the sagittal view, you'll see the rest of the bones. You have 2 temporal bones, you have 2 parietal bones, and 1 occipital. So all of that makes 8 cranial bones. Why is it important to know it in CT necessarily? Why do we have to know the bones again? Landmarks, right? And what's underneath each of your cranial bones, right? The parts of the brain. So if you're scanning the brain, obviously you're going to see bones, and then you'll see the parts of the brain tissue that are underneath these bones. Frontal portion of the brain will be underneath frontal bone, and so on and so forth. And every one of these bones will have certain structures underneath them. When we talk about, let's say, sphenoid bone, for example, very important bone. It has a lot of very important structures inside the brain that are connected to sphenoid bone. For example, what do you remember about sphenoid bone? What's the most important thing about sphenoid bone? Okay, there are sphenoid sinuses. What else?
They have attachments to all the rest of the bones.
Correct. That's another one. Another good thing about sphenoid bone. What else? In the ciliturcica, there is pituitary gland, master gland, hypophysis, same names for the same thing. So that's why sphenoid bone is one of the most important bones, and it does articulate with all the other cranial bones. Look at the, again, you'll be seeing a lot of these 3D CT reconstructions, looking at different bones at differently. There's the AP and there's the lateral view of the skull. I think this was an extra slide I had there. So let's look at the base of the skull. When you look at the base of the skull, and you'll see this as one of the first slices of the CT head that you'll do, you'll see that the cranium is divided into 3 different fossas. What's a fossa? Depression, cavity, if you want to call it. So there's the anterior cranial fossa, there's the middle cranial fossa, and you've got the posterior cranial fossa. And certain bones obviously fit under certain fossas. And it's just, again, it's our brain who wants to group everything together, right? It's easier for us to group things together and say, oh, okay, so occipital bone is in the posterior cranial fossa. It's just another categorization, and that's another putting bones in their places, basically. You'll notice that I'll be mentioning broad things and general things about each bone. I don't necessarily need you to know the details of the bones like the book is so detailed. What I mention and what I have on the slides will be important for you to know. You'll see this in the book. There will be many more detailed information about each bone that I don't think you need to necessarily know. So, go into, Jill already actually answered this. So there's one cranial bone that has articulation with all of the other bones, and that is sphenoid bone. If you think about all the other bones, for example, parietal has a lot of articulations, but it does not have with all of them. So sphenoid bone is sort of covering the base of the skull and has articulations with all the other bones. Okay. What do you think this looks like? What do you think this is? It's a coronal view of what? Sinuses, yeah. So when we do, right, so why did you say sinuses? Because you're looking at the air fluids, at air levels here, the air caps here, that's the sinuses. And we'll talk about sinuses in a little bit. But what I wanted you to know is two things. First of all, this is a coronal image of the facial and cranial bones. Second of all, I want to make sure you know your right and left. So remember we talked about this. Your left is always the right side of the patient and vice versa. Good to know, obviously, what Alexander said. He recognized where the sinuses are, and you'll see that in CT a lot. You'll see black and white and some gray for the brain tissue. Mostly when you see black, that means it is air. And if you see something inside the air, like if I was seeing some fuzzy white stuff in the air, what does that mean? Maybe some kind of fluid in there, maybe chronic sinusitis, maybe something's happening in the sinuses. So we used to do a lot of x-rays of the sinuses. I don't know, have you guys done any x-rays of sinuses? Especially on children, they still do it. And when you do sinuses, you always make sure they are what? Upright, erect, right? That way you can see the air fluid levels. On children, a lot of times, what kind of a view do you do for the sinuses? Waters, right? So waters will be able to tell you if there are any fluid in the maxillary sinuses. For the most part, if they're 2-3 years old, all the sinuses are not developed necessarily, but you'll see them, at least the maxillary sinuses, some of the ethmoid sinuses. And then what else do you do besides waters for sinuses? You'll do a lateral, both right and left probably. And then that's it. So now for adults, they're not doing as many sinus x-rays anymore. They're more doing CTs for sinuses, yeah. And we used to actually do sinuses prone. The patient will actually lie down prone and kind of like this, extend their head and do it. But now with the new CT machines, you don't have to be prone. You can be supine and images will come out fine. Do you still do PA? We don't do it. We don't. CT, you mean?
No, X-ray.
Oh, X-ray. No, I meant CT.
Oh.
When you do CT, we used to have the patient be prone, but not anymore. Right. So let's see. The book goes over every bone separately, like parietal bone, frontal bone, ethmoid bone. I don't want to do that necessarily. I don't want to repeat what the book says. You should be able to read it, and then it should bring back memories from last year. Oh, this is what ethmoid is, this is what frontal bone is, and so on and so forth. I think I have actually so for example, sphenoid, I concentrate on sphenoid a lot because I think it's an important bone in the body. So you have the lesser wing of the sphenoid, you have the greater wing of the sphenoid. We talked about pituitary gland. What else are we really concerned with the sphenoid, and why is it so important? What other nerves pass by sphenoid? Optic nerve, correct. What else? What else is important in the sphenoid? carotid arteries pass by it. Because it's in the, it's situated in the base of the skull, it has a lot of these foramens that you see, and these are the passages for the arteries and veins and all of that. So it comes out as a very important structure of the body, and I'm so glad it's in the middle of the skull because it doesn't get hurt as the other bones do, unless you get really in a bad car accident and it puts pressure somehow on the inside of the brain. But it's pretty protected, which is good. Let's see. Lesser wing, greater wing, and this is a sagittal view. The good thing about the images that you see in your book is that they always give you a reference point. Like, where did this slice come from? So it's a mid-sagittal point of the skull. When you can see the sella turcica, you won't be able to see the hypophysis necessarily because it's a soft tissue. You'll mostly see bone, and then there's the sphenoid sinus right there. Okay. Here's another one, looking at the base of the skull again. And where you're looking at, you talked about remember you said carotid passes by the sphenoid, you've got the carotid canal. What is this big whole thing here? Part of the occipital bone, actually. Foramen magnum, right? So why do we need that foramen magnum in the back of the skull? Brainstem, and then the beginning of the brainstem and the spinal cord is from the foramen magnum, correct. All right. Again, sphenoid with the body, greater wing, lesser wing, same thing. Talking about the foramen magnum in the base of the skull. A lot of the images that you'll see in this book are repeating. They're just reinforcing the fact that you're looking at different structures at different angles, at different slices. Another base of the skull, this actually is showing the zygomatic arch, which we haven't talked about yet. It talks about temporal bone, and temporal bone is also important. Why? Because there's so many structures behind the temporal bone. For example, what do you have behind the temporal bone? Tympanic membrane, the ear, right? So ear with all of its little structures are right behind the temporal bone. Another important structure. And we'll get into the ear in just a second, but let's see. So what kind of slice do you think this is? So you're looking at your reference, right? This is the skull and this is the reference slide. So what kind? What plane is it? It's an axial plane, right? You can see it from here, right? Because this is how the slide went through. And it's looking at the inner ear right there. Inner ear is really fascinating. Go through the structures of the inner ear and make sure you guys know this. This is really important. Most of the time you can actually see the inside of the inner ear in a CT. If it's done thin, very thin slices, you'll be able to see all the little bones, you'll be able to see everything that's inside the inner ear, and it's important. So the ear is divided into 3 spaces, right? The external, middle, and inner ear. And each of those sections have a certain function, right? So you've got the external ear that has the auricle and an external auditory canal. What does this part of your ear do, you think? So the sounds go through it, right? It takes the sounds, go through it. Then you get into the middle ear, which has the eardrum or tympanic membrane. The middle ear also has the 3 very small bones, very important bones in the body, in the middle ear, right? So the incus, malleus, and stapes, all the 3 bones that are kind of hanging in the mid-air in the middle of ear. Then you have the inner ear, which has another certain important parts in it. Semicircular canals are there, and also cochlea. Semicircular canals actually have to do with your balance and equilibrium. So when you lose balance and equilibrium, when you go in to your doctor and say, I'm dizzy, the first thing they look at is the ear and the inner ear and say, have you had any cold? Do you have any infection in your ear? Because that can throw off your balance. So looking at this, what do you think, where do you think the fluid in the ear is? Is it in the middle ear or inner ear? Inner ear, correct. So there's fluid in the inner ear. There should not be any fluid in the middle ear. What does that cause? Infection. If you see children have an infection of the ear, that means there's fluid in their middle ear. And that's because their eustachian tube, which is, I'm going to point it here. I'm not used to pointing on this. So this is the eustachian tube, right? So sometimes in kids, 6, 7 month old up to 1, 2 years, these eustachian tube is not developed well. So the fluid from the inner ear, from the middle ear does not go to the pharynx and gets out. The fluid gets stuck, therefore the kids get infection. One of the things they do is put tubes in the kid's ear, right? Have you heard of that, putting tubes? So they do that. They actually rupture the eardrum. They put very small, very, very tiny tubes inside so that they can take all the fluid that's inside here out. Later on with the kids as they grow up, their head gets bigger, all these cavities get bigger so they can release that pressure and the fluid goes out. But if they can't, I've seen when the kids had to do 2 or 3 times put the tube in there and get the fluid out. So that's it. And the eustachian tube comes from, I think it was an anatomist called Eustachian, and that's why we call it eustachian tube. Auditory tube, same thing. And it, like I said, it connects to the pharynx. And that's how any kind of fluid that you have in your ear can get out and go into the throat and out of the ear area. Questions about the ear and the structures? Okay. Moving on. Here's actually the structure of the inner ear that we brought it out. We said that the semicircular canals and then cochlea are the 2 main portion of the inner ear. What does cochlea do? It actually has the nerve inside of it. So if the nerve, the cochlea is damaged, you won't be able to hear. That means your nerve is being damaged and hearing is hard. So important, very important part. And we said semicircular canals have to do with your balance and equilibrium. Here's another image, an axial image that shows inside the ear. Again, you'll see in your book, I'm just taking them from the book, how it shows the external EAM and then all the way inside the ear. I probably won't give you something like this on a quiz or a test and say, hey, tell me what this is, or distinguish between the small bones. I would give you like I'll give you something that's really obvious, like where is the EAM, for example. You should know that. But the smaller stuff, the smaller structures, I won't expect you to know. Because I don't think it's necessary to know all those small stuff on the CT. All right, so I don't have clickers, but I want you to just kind of get your knowledge out there and see if you remember. So the inner ear is normally fluid filled. True or false? Who said false? Okay, so inner ear. Remember, the inner ear, that's where your semicircular canals and cochlea are. So that's mostly fluid. There is fluid inside. It's the middle ear that cannot have fluid in it. Okay? All right, so auditory tube or eustachian tube is connected to this part of the upper respiratory system. Pharynx. Pharynx. Okay? Questions? Before we get into that, I want to make sure there are no questions. Then we get into groups and then talk about that one problem that I have. It's like a case study I want you guys to handle. Yes? I'm sorry?
Did you mean that it's connected to the upper part of the digestive system?
No. Respiratory system. Respiratory system. Upper part of the respiratory system.
Oh, okay.
Pharynx is part of the respiratory system, not digestive.
There's the oropharynx and the nasopharynx.
There is the oropharynx and then the laryngopharynx that goes down. So it's the respiratory system. Any other question? Jill?
Will you give us those like super helpful little like outlines of the skull next to the actual CT image?
Yeah, if I give you a CT image, I will give you the reference point so
Okay,
that
like
you know, yeah, doing testing.
Will they do that for our AARTs?
No, they won't. Yeah. Yeah, no. I know, it's very, but the point is to get used to those. You know, you might want to even test yourself. Look at the image without looking at the reference and see if you can tell. And then look at the reference. The more you look at these images, the more you test yourself, the more your eyes get used to it. And then the more landmarks you know, the better you know where you're at on your slices.
Because I was going through the book chapter 2 ahead of time, and it was like, it's filled with like slice by slice by slice by slice. So the ones that we should focus on for testing is the ones that are on.
That I'm on my PowerPoint, yeah, definitely. I don't want to put all of those images obviously on my PowerPoint. It's going to be too many images, but this is what this book is notorious about, having so many images and so many slices that people just get confused and they're saying, well, which one should I learn and which one should I study from? But from my PowerPoint would be the best to go through. Okay, so get into your groups. There's going to be a case study that I want you to come up with some answers for. Hopefully you know where your group is. Yes? You don't know your groups? Come on, guys. Did somebody write down the name of the groups for me at some point? Did I have somebody write them down?
No, you had each of
Or
us
did
write-
I write it?
We had each of our groups, or each of our names on one card.
Oh, on that one card. I didn't bring the cards.
Write it for you in one.
It's okay. I'm gonna find out if I have the card upstairs. If not, I'll let you guys know. Right. Now Okay, so just a few more things about the cranium. Sutures and fontanelles. Those are the two things that we'll talk about. Sutures are basically articulations between the bones because your bones are not all one bone. They're different bones and there are sutures in between them. There are articulations between those two, and those are called sutures. There are different kinds of sutures. You'll see, for example, squamous suture is in between temporal bone and parietal bone. You have occipital suture or lambdoidal suture, that's between the occipital and the parietal bone. You'll have frontal, I think it's coronal suture, right? The coronal suture is between frontal and parietal. So these are just different articulations and you'll see them when you do CTs. Why do we need to know about these sutures? For example, that's a suture. So I don't make a mistake of saying, oh, maybe that's a broken bone. It's not really a fracture, it's a suture. So we need to know the locations of those in order to be able to say what's normal and what's not normal. Important to know those sutures. Next one we're going to talk about is fontanelles. Have you seen, I don't know, for those of you who have kids, anytime you take them to between when they're born up to 2 years, when you take them to their pediatrician, they're checked the top of their head. That's for their fontanelle or their The anterior, the soft spot, exactly. Bregma or anterior fontanelle, which is the largest fontanelle. That's basically the area that's not ossified yet, calcified yet. Until they're 2-3 years old, this area is kind of soft. And they touch them just to make sure it's not, it hasn't grooved in or it hasn't popped up. So what happens if it's not flat? What if it's like popped up? What does that mean? What's going on inside the brain? Pressure, exactly. When there's a lot of pressure inside the brain, that fontanelle kind of pops up like this. What if it goes down, groove like this?
Dehydration?
Exactly, dehydration. That's what it means. There's something going on with the brain. So they always check that part. The rest of the fontanelles, when the baby is born, they're pretty hard and they get really, eventually get calcified. So those are also important if you're ever doing a pediatric case, pediatric CT, you need to know those fontanelles. The biggest one is bregma or the frontal fontanelle, which we just talked about. Then you have a anterior lateral fontanelle. The name says it, anterior lateral, right? And a couple others that the book mentions, posterior fontanelle, for example, there's another one. Anterior lateral is also called sphenoid fontanelle. So know the main ones. I might just tell you, name all the fontanelles of the brain. So you'll name them. It's not a big deal. Something to memorize. And then, or I might say, what's the biggest fontanelle on the brain or on the head? And you'll say anterior. Okay? And there's another 3D picture of the brain of a child, which shows sutures and also the fontanelles. Questions?